You're concerned about the rates of HPV vaccination.
Yes, they've not increased at all among females from 2011 to 2012, and we still have a ways to go with vaccinating males since we just started the universal recommendation at the beginning of 2012.
What are parents' concerns? You mentioned that parents holding back is part of the problem.
I think so. Unlike the other vaccines that we've introduced for the teenage years, these have been slow to gain acceptance among parents, and parents express concern that they won't be starting or completing the series. They're expressing concerns with the safety of the vaccine, with the timing, thinking that their children are too young for the vaccine, and a third concern, thinking their children aren't at risk ever for HPV disease.
Is there any reason to believe what we hear about, well, if I give my child the vaccine, it's an invitation to have sex early?
I have heard that from parents, but studies have now been done and published that show no change at all in teenagers' behaviors as a result of the vaccine. The vaccine is given to prevent a disease that is sexually transmitted, but in no way has this resulted in children taking more risks and being promiscuous in behaving in such a way that would cause them to develop other sexually transmitted diseases or pregnancy.
Parents I've spoken with say, well, my pediatrician never told me about this, or maybe they told me about it for my daughter, but not for my son. Where's the disconnect there?
Well, we started vaccinating girls in 2006 to prevent cervical cancer. We didn't have a universal recommendation to vaccinate boys until 2012. So when you think about the life of a teenager, busy, difficult to schedule, rarely needing a doctor visit, it's quite possible the parent's last visit was before we started the universal recommendation. And perhaps it was, in fact, with the female and not the son, and thus resulting in the disconnect. So it's a new recommendation for boys, but it's a very important one.
There's always a risk with vaccinations, but it seems the protection outweighs the risk. Can you talk about that?
Yes, we need to recognize, first of all, among all of the medicines, therapies, and treatments that we use in medicine, vaccines are among the safest things we do. Not dangerous at all, and much better tested than our medicines we use, such as antibiotics or other medications we use to treat diseases. In fact, before we license a vaccine, we've usually tested the vaccine in 10 to 100 times the number of people than we would have tested for regular medicine. Furthermore, we continue monitoring the safety of the vaccine in millions of people after the vaccine is routinely in use. I would say yes, it is a biologic, so there is a risk, and particularly a risk with an allergic reaction. That risk is around the ballpark of 1 out of 50,000, and usually you can reverse the signs and symptoms of an allergic reaction to a vaccine.
And isn't the bottom line, though, I mean, I think parents, they don't realize, well, maybe decades from now, my son, maybe my daughter could actually get cancer of the throat, cancer on the tongue, of HPV related. So isn't the message, I can give my child a shot now and they will never have to face that?
That's what we want to get out into the community. Now we have a vaccine that we can give an 11 or 12-year-old as it's routinely recommended. Here at Mayo, we actually start at 9, knowing how difficult it is to get all 3 doses in the teenage years. And we do have permission from, as do clinicians across the country, to begin that early. But we're talking about a durable vaccine that can protect them as older adolescents or young adults from a disease that is so common that 80% of all adults by the time they're 50 years of age will have suffered an infection with it. Now, most will have cleared it, but some go on to have cancer of the genitals or of the head and throat. So we have an anti-cancer vaccine, a vaccine that we can give our children when it works best to give them durable immunity against cancer. Now, I wish it could prevent it against all cancers or all cancers caused by HPV. This vaccine is designed to cover 2 of the strains that cause 70% of all those cancers. And it's close to 100% effective, and it's very safe. So for me, it was no question my children should be vaccinated against this vaccine, and the patients in my practice should get this vaccine.
And also, now that we're seeing this population of middle-aged, non-smoking men with oropharyngeal cancer or cancer of their oral cavity, I believe we can change the future of this cancer if more and more young people are vaccinated now. Is that true?
Yes, we have great evidence that this vaccine produces in nearly 100% of its recipients effective antibodies to prevent infection against the viruses that cause HPV head and neck cancer, HPV cervical cancer, HPV penile and anal cancer. Now, you have to get the 3 doses, and you have to get them before you're exposed. But we're already seeing evidence that our vaccinating in 2006, the girls that did get vaccinated, we're already seeing a lower rate of cervical dysplasia and cancer. We have every reason to believe it'll be just as effective against these other cancers. It's actually only been recently that we've put together this connection of HPV with head and throat cancer. In fact, the evidence came out after the universal recommendation for boys. So in fact, the literature, the recommendations don't speak to the head and throat cancers that this can prevent. That's actually a new finding, and really one can't really call it just icing on the cake when one thinks about this benefit, because in a few years, if we're not effective, we will actually see more head and throat cancer than we'll see cervical cancer caused by HPV in this country. We must act.